Saraman. I'm one of the co-investigators at the Ludwig Boltzmann Institute of Digital Health and Prevention. From my professional background, I'm a specialist in cardiology, sports medicine, and rehabilitation medicine. Besides, I'm also an endurance athlete using the Garmin ecosystem for more than 10 years now. So I think I know quite a bit about the potential, but also limitations of the Garmin ecosystem. That's why I'm not only honored to chair the session, I'm also very curious to hear the keynote talk held by Dr. Liam Brudy from Garmin Health. Short introduction, Dr. Liam Brudy is a business development manager at Garmin Health, where he's in charge of data-driven partnership in research and also clinical trials. Before he started working at Garmin, he was a researcher at the Technical University in Munich, mainly investigating the role of physical activity in quality of life in patients with cardiovascular disease. The title of today's talk from Dr. Brudy is The Future of Consumer Wearables in Healthcare, Data-Driven Solutions Around a Connected Ecosystem. Dr. Brudy, the stage is yours. You're muted. I still can't hear you.
All right, now here we go. Yeah, so I wasn't able to unmute myself, but someone from the technical side helped me out, so thanks for that. Also, thanks for the very nice introduction. While I get set up here, give me a moment. I think the title of my presentation has already been shared, and yeah, it's very exciting for me to be here today to give a few insights on our point of view on the topic. So thanks for the invitations. Also, thanks to Professor Schmidt for a very exciting introductory keynote. I, of course, had to stand up right away when the topic came to standing desks and how people are, keep forgetting about them after a certain while. I will be talking for next 15-20 minutes about the future of consumer wearables in healthcare our data-driven approach on this topic. Why do this and how we want to do this and how our connected ecosystem works in that space. And even though we're online, I want to do a little bit of an interactive format here. So if you would like to, no need to, but if you would like to, you can take out your smartphone, scan the QR code here on the left side, and then I can, we can see some answers coming up coming up here today. For me, this is mostly important because it gives me some ideas of what interests you, not only maybe I can still adjust a little bit my presentation here today, but also for future conversations. What do researchers, what do people in this space really want to learn when seeing Garmin and Garmin Health on a presentation agenda? While some participants are already answering, I want to talk a little bit what I want to cover today. I want to split my presentation a little bit in two halves. First, I want to talk about what does Garmin Health do? What is Garmin Health? And primarily, what is this connected ecosystem that I'm talking about here in this title? And then second of all, I'd like to look at the future a little bit by talking a bit more about the present and talking about some use cases. We see some answer coming in. I won't be able to go much into Black Friday sales, but that's all right. We have some answers here and how wearables can be used in research and healthcare, and how to use data from wearables in research is, of course, on the agenda today. We'll take a look at this towards the end again, but from the answers coming in, I think I at least will be covering the right agenda topics. Talking a little bit about Garmin Health. Of course, Garmin is a company that doesn't need much of an introduction. A lot of you might be using some sort of Garmin products. Primarily here, we're known for our wearable devices. Garmin is also quite active in the automotive, in the marine, and in the aviation segment. But yeah, wearables, fitness, and outdoor devices are primarily what Garmin does. And Garmin has been doing this for a while. Not only the aviation part, which is kind of where Garmin is coming from. Back in the late 80s, it was founded by two engineers. One was named Min, the other one was called Gary. So Garmin is where the name is coming from. And since then has developed many different products, and was in the early 2000s the very first company to, or one of the very first companies to also develop sports watches, primarily by our engineers who were also runners, taping GPS devices to their wrists. This has, of course, developed a lot over the last 25 years, and especially around 10, 15 years ago, started really a steady increase in this development with the introduction of optical heart rate sensors on the back of the devices. And as Garmin and Garmin Health, we consider ourselves to be the market leader in the device portfolio on health, wellness, and fitness devices. Talking a little bit more about Garmin Health, the department that I work for within Garmin, I want to illustrate these a little bit by raising these questions of what these three logos or these three companies that you see behind these logos might have in common. All pretty common logos, of course, NASA and then Formula One, along with Garmin, are all in some sort of way really in an elite space of what they're addressing. NASA is, of course, the space agency, then Formula One is kind of the probably most elite form of motor racing on the planet, and then Garmin, a company that's primarily known for the very active, very fit people, at least in the wearable space, because you often choose a Garmin device if you are looking to run a 5K, 10K, triathlon, marathon. Those are really typical Garmin users. What is Garmin Health then? Well, that's a little bit explained by looking at how these other companies, NASA and Formula One, really have an impact on our everyday lives, or our everyday lives of regular people. So no one of us is an astronaut or a Formula One race car driver. Nevertheless, with in-ear headphones or just thermometers being developed by NASA, or the kind of communications techniques that a lot of surgeons use in operation rooms that have been initially developed in Formula One settings, so communicating in high stress environments. Similar to that, we take a lot of things that are used and developed for elite level performers and apply them to our lives. And the same is true also for Garmin, and it's pretty much the kind of the realization elite performers or humans too is what combines these, or what these companies have in common, and then also what is a little bit behind Garmin Health. Because, and I want to explain this by a metric that for Garmin is used in a very elite context. For Garmin Health, you see that there's an application in everyday people's lives. I want to do so by looking at fitness as measured by VO2 max. I think VO2 max is a concept that everybody in this audience here is very familiar with, so I won't go into what that specifically is. But if we look at VO2 max and start here at the very right of this continuum, we're on the fitness level, at a very excellent and a very elite level, VO2 max is really a performance metric. It's a level for performance athletes, whether it's in soccer or football or at a world-class marathon level. If you increase your VO2 max by X%, don't quote me on these numbers here, but increasing your VO2 max at the very high end results in, or could result in, the difference between winning a medal or just placing somewhere in the pack. The same is still true at the recreational or at the at least very ambitious level. So if we look at 3:30, our marathon runners, still very good recreational athletes. For them, VO2 max and fitness is still a performance-driven metrics, because no one of us, even though I really like if I run my 10K a little bit faster, no one of us is really getting paid for this or is at an elite level. So it's still though performance level metrics, because the benefits I gain, while there might be some that are health related, it's still more about the bragging rights that I gain by running my 5 or 10K a little bit faster. But if we continue moving a little bit further to the left of this continuum, this also helps us understand how the same metric is then suddenly, or at some point, doesn't become a performance metric anymore, but really a health metric. Because if you move someone from an average to a good fitness level, it can really be the difference maker in whether you have a quality of life ahead of you, a few more years of quality of life ahead of you, or if you have more illnesses ahead of you. And then if we're at the very far end, this is where my initial research came from at the very beginning, before joining Garmin. Increasing a VO2 max from a poor to at least an average level is really the result, or the result of that is a reduction of mortality risk. So it's not really, doesn't have anything to do with performance anymore, but is primarily and really solely a predictor of survival and a measure of health and well-being and healthiness, or the absence of sickness. And this is not only true for VO2 max, but also for other conditions that can be measured by wearables, whether that's Garmin or any other wearable, that's secondary at this point. But whether we look at anxiety or depression, pre-diabetes indicators, hypertension, sleep apnea effects, all these things are preceded by an increase in metrics that we can measure with a wearable device. And this is really where Garmin Health then comes in, because for us, for Garmin, and if we look at the mission of our department, it's really about improving people's health by creating world-class devices and providing a connected ecosystem. I hinted towards that connected ecosystem a little bit at the beginning and with the title of my presentation, and I want to also go into that now a bit further. But this is really the key for us. It's not just the devices and the metrics that might be a lot of you knowing, but the data-driven part and the ecosystem that allows data to be shared from these devices. Quickly covering this is not as super important here, but we do so in many different areas. Healthcare research and clinical trials is really the most interesting one, I think, for this audience here. But looking at the ecosystem, and this is also why we move a little bit more towards the future. The ecosystem is really about, having the devices part and a data-driven part, and then partnering with outsiders, whether that's researchers, whether that's healthcare providers, whether that's insurance companies, whether that's other stakeholders in the healthcare system, to then develop a solution that serves then the purpose it's supposed to be serving, whether it's improving patients' health, having a patient monitoring system, or doing some research at first. It doesn't really happen without data sharing. This is, of course, still a little bit abstract, so I want to spend the next few minutes a little bit about how this has been used in the past in a healthcare and in a health-related context. And then this helps them also understand a little bit why this collaborative approach for us is so important. One example that has come out of that is the biological age modeling. Some of you that might be Garmin users know about Garmin Fitness Age, which is in the end a predictor that shows the difference between your biological age and it's in the end the difference between the age you have in your passport and the age you have based on your lifestyle choices. This, of course, can be higher than your passport age, or ideally, and this is why it's important and was developed together with SCORE, an underwriter for insurance companies. This, of course, is also very interesting in the risk assessment part, if you can, or if someone is below their passport age. In the end, we developed this based on VO2 max, resting heart rate, and BMI measured by scales that can measure BMI, and it can measure body fat percentage, and intensity minutes during the day. So relatively simple metrics. It only really comes to life by data sharing, and how that then is used through our ecosystems. Then it's simply a way of sharing my fitness age in onboarding process of getting a new insurance policy, for example, via a simple server-to-server transfer from my Garmin account to the insurance company, for example. And that helps then my insurance to assess my risk much more individualized, where we're in the precision health medicine space, and give me a better offering than if I don't have, for example, this data sharing mode enabled. Even more so and even deeper, that's also been part of this relationship in the past, is the Vitality program that is really, in my opinion, one of the best and most rewarding ways for people in generally living a healthy lifestyle and then having a positive impact on their behavior change. So Vitality is a program distributed initially by Discovery, a South African insurer. Vitality is their program that enables, or is at least supposed to, engage in behavior change based on hyper-personalization. How it works essentially is you can earn a lot of different points in a reward system, whether it's making good choices when shopping at the grocery store, or reaching your steps on a daily basis, reaching your intensity minutes on a weekly basis. And then people get rewarded based on this highly personalized, data-driven approach. And what they have found is actually quite interesting, especially around physical activity. Those are all things that we've known so far. They have a tier-based approach where the most rewarded ones, that means the ones that make the best choices when grocery shopping or living the most active lifestyles, had a significantly lower mortality risk during COVID. And this was especially significant because the ones in the highest bracket were also their oldest clients or customers in their insurance segment, which of course had a higher risk for mortality during COVID anyways. So they really have a very highly personalized, data-driven approach to their not only customer engagement, but also behavioral change program. Skipping a little bit ahead, I'm not going to cover this Daimler case because this doesn't have as much to do with health, but more towards something that's then specifically in the research space. And this is a project coming out of the DIU, the Defense Innovation Unit of the US military, who, with the beginning of COVID, realized, as every other institution, hey, keeping our workforce healthy is super important, especially in the pilot space, because there's not that many elite pilots out there. So the longer they can keep them healthy, the better. And what they did, they used wearable data, not only from Garmin devices, they also used other wearables, but from Garmin devices, and then their own proprietary algorithm to predict COVID-19 infections. And the initial results were quite good. In the end, they had a system in place, or they still have a system in place, I believe, that helps them to single out individuals who might be at risk to have symptoms of an infection, whether it's COVID or not, up to 2.5 days before, which gives them a huge advantage in kind of separating out this individual. And with this prediction space, we're also moving towards the future a little bit more, because this is where we see, and where I see specifically in the research space, the biggest advantage of an ecosystem based on data sharing. Some more use cases really from the insurance space, whether it's panic attack prediction, where a lot of data is being used and collected over a long period of time to predict, not necessarily say, hey, you're about to have a panic attack, but more you are in the process of worsening your condition, take these measures to counterbalance that. Whether that's in the context of the health monitoring in offshore wind farms, or the digital mapping of sustainable cities, where Swedish researchers looked at how are people experiencing cities, green environments versus gray environments. In all these cases, a lot of data is very helpful, of course, because you can not only ask people about certain things, but also monitor behavior based on activity, on sleep, on stress, on exercise over a long period of time. And then hopefully, and that ties back to the first keynote we heard today, with a lot of this data, make some good prediction models that actually help improve people's life in the end. with this, I'm also coming to the end a little bit, looking at the time. The last message that I hope to share here with you is really this one for us, and that's speaking for Garmin, is really the future is really collaborative. Because as you see with all of these use cases that I've presented here in a very brief overview, it is for us not possible to develop all these things our own. And in fact, we don't even want to do this. For that, we have developed a data sharing ecosystem, or an ecosystem that allows data sharing, and then to really work with specialists, whether it's in the research space, in the patient monitoring space, in the corporate wellness space, in the insurance space, to develop good solution based on all of this data that in the end helps benefit individuals from, in the Vitality case, a hyper-personalized approach. I see we're a little bit close, or we're already close to the end, so I want to conclude this kind of here. If there's any things that you'd like to ask me now, of course, you can do so in the chat. You can reach me via my email address, connect with me on LinkedIn. And with that, I'd like to say thank you. And yeah, I think we'll be opening up for questions a little bit.
Yeah, thanks a lot.